Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel. If you are new or a regular viewer here who has not had chance yet to subscribe, please make sure you do so that way you help everybody else find this content. If you don't yet follow me on Instagram, what are you waiting for, people? I mean, I put out such inspiring and positive and uplifting and incredible content, especially for trans women on Instagram. Go follow me. I promise you. You're going to enjoy it. You're going to love it. And you're going to find it very empowering and very uplifting. Link is below. For today's video, I am going to try not to be angry. I'm going to try to be calm and as mindful as possible. But the topic of today's video is, I'm going to be honest with all of you, really bothers me a lot and really bothers me quite a bit, especially as somebody who has focused on specializing exclusively in gender affirming care for the past 20 years, exclusively focusing on gender dysphoria, especially as somebody who knows a lot about gender dysphoria, a lot. Now, I can't call myself an expert on gender identity because it's like saying I'm an expert on all of the people out there and all of the numerous variations and expressions of gender identity, and that would be it's just impossible. But I can say that I am an expert on gender dysphoria, and by expert, of course, nobody ever knows everything to a T, for sure, not me. But when we say an expert, we mean, or specialist, what we mean is a person in, at least within their field. For me, it's a clinical psychology. The person knows more, possesses more knowledge, way more knowledge than anybody out there on this particular topic, due to their experience and due to their immersion in work over a long period of time. So I feel pretty qualified to talk on this topic today, and I feel pretty qualified to share my opinion and to explore this topic with all of you further. And the topic for discussion today is medicalization of gender identity, specifically in this case, transgender identity. Now, when I say medicalization, what do I mean by that? Lately, I have seen more and more discussion and more people talking about, especially within transgender communities themselves, people saying that one is not transgender unless they are on hormones or unless they are having surgeries. Again, one is not transgender, whether it is transmasculine, transfeminine, non-binary, all of the other identities underneath those big umbrellas, unless they are going through the hormones and they're going through surgeries. So there's a lot of problems with this type of narrative. There's a lot of problems with this type of discussion. And I see this especially a lot in trans women circles, in trans women communities, specifically a lot in regards to trans women who decide not to have bottom surgery, who, for whatever reasons, that is nobody's business, decide to keep their genitals, decide to live a life with a penis. Again, for whatever reasons, could be, I'm comfortable with my penis. I have no dysphoria in regards to my genitals. I have a healthy relationship with my penis where I don't see this as a masculine attribute. My health prevents me from having surgery I want, or I don't have the funds for it. It's just not worth it for me at this point in my life, to you name it. I see this again specifically in trans women circles where other trans women say, you are not woman enough because you're not on hormones, or because you are on hormones but you're not socially presenting, or because of this, or because of this. It's like everybody today, for some reason, has a very strong strong, suddenly, I want to say an opinion, but it really sounds more than opinion. It's almost as if everybody's suddenly an expert on identities, right? And it, a lot of people are starting to put down this exclusionary things. You're not unless, you're not unless, you're not unless. Another one that I hear a lot, and it makes me want to just break something, that this is the feelings that it elicits in me, is when people say you're not transgender unless you have very severe gender dysphoria. People who say this have a very narrow and limited understanding of dysphoria, how it manifests, how it presents, how it affects individuals across lifespan, across contexts, across cultures, across circumstances. No two people ever experience gender dysphoria in exact the same way. Gender dysphoria ranges for individuals, and the way it ranges dependent on multitude of factors, including one's psychological makeup. So to say that you're not trans unless you have severe dysphoria is another harmful narrative, because it basically invalidates people's felt sense of being, and it further creates barriers where people then are put in position to believe that it's true, and therefore they don't step in the gender transition if they want to, if they need to, because they feel like they're not allowed to unless they're in so much distress and pain. And that's not true. All of this is a way of medicalizing gender identity. It's a way of saying that your identity as a trans person, your way of saying you're transgender, your way of saying you're a trans woman, your way of saying you're trans man, your way of saying you're non-binary, is defined by hormones in your body, and is defined by the surgeries, gender affirming surgeries. Let's put it that way, because there's a lot of them. It's a way of saying that up to this point, when you became first aware that you're incongruent with your assigned gender, maybe at age 4, 5, 7, 12, 13, 20, 30, 40, 50, 60, 70, when you first became aware of your gender identity, when you first became aware that you're not comfortable, not aligned with your assigned gender, none of that matters. Because guess what? These people are saying your gender identity doesn't start until you actually go through hormones and medical transition. It makes zero sense. And the truth is, and this is nobody, well, I don't want to say nobody's talking about it. Maybe I don't talk about it. Not maybe, I definitely don't talk about it enough. Your gender transition does not start with medical or surgical. For some of you, medical and surgical may not be on a table and may not be something you're going to have as part of your transition goals. For a lot of you, your gender transition started already that moment, 4 years old, maybe 7 years old, maybe 12 years old, maybe 20 years old, when you actually realized, when you had an acknowledgement, when you had an understanding, when you had an aha moment that you are not your assigned gender. That's when your gender transition started. It started with it. That's when you internal, psychological, we can say psychological, we can also say spiritual, we can also say, I don't know, there's so many words to describe this internal thing. That's when it started. Because from the moment of that realization, that's when you started looking at the life, started looking at the world, started looking and evaluating your relationships with people through the lens of, they see me one way, but my internal makeup, my internal landscape, my internal blueprint, my internal archetype, my internal schema, my internal soul is not how they see me. It's not actually who I am. And the dysphoria that you have felt and experienced throughout the duration of your life, whether you manage to cope with it well or not, was dysphoria that arose out of that tension. But it doesn't negate that you have been transitioning all of your life. You have just not been transitioning externally through socially coming out, presenting yourself, legally changing your documents, hormone surgery. Again, if all of this is your plan. But internally, when people come to me and they say that they've been aware, for example, they've been aware that they're a woman since they were a child. In so many ways, you have been living as a woman since that age. Again, you were not externally living out the role, because we still live in a world where so much of how we look, how we present, wrapped up in gender. But here, you did. And you weren't always able to externalize it again, but here you knew and you felt. So transition starts already at an early age. Your gender identity is this. This is why when people do very reductionistic and not analytically thought of and not critically thought of questions, such as, what is a woman? Describe to me, what is a woman? What is a man? This is why people stumble. This is why people get different answers across the board, because it's a subjective reality that revolves not just around anatomy. And yes, anatomy is part of it, right? It doesn't just revolve around physiological or just your chromosomal assignment, but it also revolves around your internal experiences, your external experiences, so many other things that make up that subjective felt sense. This is why one can't just reduce it to it's an anatomically adult female. Because, again, anatomically adult female, okay, let's break down it. Once you start breaking it down, you just run into wall. It doesn't lead you anywhere. Because for a lot of people, even their anatomy there's so much overlap between even sexes. So much overlap. It's not as polarizing as we were told to believe. So when people say, this is why, again, it's so difficult to describe, because your identity is your internal. It's your internal, not only felt sense, but your internal, I would say again, a blueprint. Your internal landscape. Okay? So when people say you're not trans unless you have severe dysphoria, are on hormones, going through surgeries, they're reducing transgender identity to medical interventions. And here's the problem with this. The problem with this is that not only does it negate and disregard a lot of people who are not interested in it, it also negates the whole spectrum of non-binary individuals. It also negates the whole spectrum of trans individuals who have maybe social dysphoria, but not so much physical dysphoria, where the distress is more external than so much caused by internal physical aspects, where they feel compelled to do something about their body. I know for some people this is difficult to comprehend, okay? But it also limits our identities, our gender identities, to certain medical things. It's almost like saying, a woman is not a woman is not a woman unless she lives up to this objective symmetrical idea of what we currently perceive beautiful, right? That ratio hip. I don't even know what the numbers are. I don't think I ever knew. The hip, hip breast butt ratio, whatever the ratio is. And the face has got to be all symmetrical, and her breasts are supposed to be a particular size. And if you're not that, you can't really call yourself a woman. So go ahead and cosmetically modify yourself until you do. The world doesn't operate like that. Saying that you're not trans unless you go through medical surgical is also superimposes an idea that somehow we all are alike, or we ought to be alike. The world is not like that. It's not like that. We're all very different, and we all have different needs, we all have different wants, we all have different ways of expressing ourselves. It doesn't operate like that. So this is my biggest beef, my biggest problem is medicalization of transgender identity. And first of all, it's false. It doesn't work like that. Second of all, it's not helpful, it's harmful. It shepherds people into medical and surgical when they may not even need it. You know me, I'm a huge, huge supporter of gender-affirming surgeries and gender-affirming hormones. If that is something that is part of your goal, if that is something that you need to do, I'll be the first one to support you on your path. But if it is something that you're stepping into because you feel like otherwise you don't belong, because you feel like otherwise that's what the community told you, because you think that somehow you're lesser than if you don't go through that, then I'm sorry, I'm going to be the first one to tell you you're selling yourself short. Okay? So it's really important to understand how broad gender transition are, and really important to understand that for a lot of you, for all of you, it starts at an early age. You've already been going through gender transition, and your gender identity is not dependent on all of these factors. Gender transition, all of elements of it, what it does is it gives you, it basically says, okay, we live in a world where the word still genders our bodies, the word still genders us based on particular aspects, particular gender markers, gender qualifiers. And in order for you to feel safe, even in a lot of places of the world, in order for you to feel accepted, in order for you to all of the other factors, part of the gender transition is, here's the tools, here's the surgeries, here's the hormones, that on top of helping you, if you have gender dysphoria that needs to be alleviated by those tools, by those treatments, it's also going to allow you to navigate the world in a safer way, navigate the world in a way where you feel more inclusive. And yes, one can argue that is necessity for so many people, and absolutely it is. And in so many other places of the world, and it's becoming more broad, for a lot of people, it is also not a necessity. It is not. So it's really important, instead of shrinking and constricting one's identity and transition to just medical and surgical, to understand how broad it is. Right? It's really important. This is why I talk about trans women who so much on my Instagram, because I want to help trans women find a way where the steps all of you are taking are rooted in your needs, rooted in your own personal standards. What's important to you? What matters to you? Versus trying to put yourself in a mold and in a box. Because even if you put yourself in a mold and a box and you feel like you're accepted, you're still having an illusion of acceptance, because you're being accepted for a mold box you created, but are you the mold and box? Like I always say, if the stereotypes of what a woman is out there, or any other things out there, truly you feel resonance with, that's different. go for it. But don't just go for things blindly because you feel that's how ought things to be. Because in the end, again, you're the one who is not going to feel connected to it because that's just not going to be you. Comment below. Let me know what you think about this. Share your thoughts on this. I'm very, like I said, I'm very frustrated hearing this. You're not trans unless you go through surgeries and hormones or have severe dysphoria. Those things don't define your identity. Absolutely not. They help you externalize your identity, yes. Do they help you define? Do they define it? No. Your defining of identity happened before you even maybe became aware that the hormones and surgeries are out there. So comment and share what your thoughts are. Love hearing all of your comments, and I will see you all next time. Goodbye.